Today, it's all about black mental health. I suppose importantly, it's to make the community in Croydon aware of this kind of work that we're doing within the Croydon BME Forum, that we do have the IAG, which is the Independent Advisory Group, that they can access. That group gives them a voice. It gives them an opportunity to start influencing the changes that they would like to see.
I think today is really about bringing the community together and to breaking down the stigma and raising the trust between the charity and also the statutory sector as well. We need to bring the community together so that we can talk around the table and hopefully come up with some really good solutions.
I'm here to listen, really, and meet people. That's the main thing that I wanted to do, because when Andrew and the team at BME Forum bring people together, you get some real passionate people who want to make a change, and I just want to hear what they've got to say.
I think today was important because it reminded us that we are the many. Sometimes we forget that because the work that we're doing is often very lonely, because often we're not with 200 people. Often it's just me by myself or you by yourself, or the many individuals by themselves against the system. So really what today kind of reaffirmed is actually it's not just me against the system, it's the many against the system. That's why today was important. It was a reaffirmation of our connections to other people. It was a wonderful thing.
So I'm here to share information and to learn from others, but mainly to spread awareness and to help to build a sense of community cohesion. We are stronger with numbers, and so that is my hope for today. So I don't think the disparities in intake care, seclusion and restraints is a surprise to anybody. I think what is an issue is that actually people need to understand that actually PCREF is providing us with the opportunity to have a say and to be a part of the change that we want to see within our society. So I think when people get their head around that and understand the unique position that we're in to actually drive change and, inform change, I think at that point we can then begin to have different conversations and be hopefully speaking about brighter statistics.
Well, the breakout room gives people the opportunity to have more of a connection within the breakout room. So it was quite good because they were able to select the ones that they felt that was useful to them.
So today we're doing some art workshops, and incorporating therapy into the art can be better than having clinical therapy because it can be quite intimidating to just talk one-to-one with a therapist. So having a different way where you can be creative and you can be open as well, and it's not too forced to open up.
I think workshops are important because it can help to foster a sense of togetherness. Within the workshop, what you find is that actually you have allies, accomplices, and you have people that are there by lived experience as well. It's an opportunity to learn from each other, but also to share, and it creates a shared sense of understanding around specific issues.
Basically, it's about providing a safe space, and I think that's what people want, a place where they can come, express themselves, and not be ridiculed. Everybody's coming here to learn.
Oh my goodness. What I can say is that it was just awesome that the black community can come together. They're beginning to learn, upskill, having that awareness, understanding mental health because it's so rife in our community. So for me, it's seriously about just making that connection. And I'm hoping that they've left holding on to something that we've achieved today.
I would leave the forum really hoping that there's more things accessible for people and that people of black and ethnic minority groups feel comfortable and confident enough to reach out to services and that they actually get the help that they are looking for and they don't get stereotyped and they don't get judged and misunderstood. And there's actually people that can represent them as well, like people that are in these spaces in the NHS and in our communities that understand them and not just there for a paycheck or a job, but they actually want to see change and help these people in our communities.
My hope is what we're going to do next week, and the week after and the month after. I think there's a real opportunity and a real task in front of the many leaders here today. We've got to now take the energy from today and organise next month and next week and 3 months' time and 4 months' time and start putting into actions the solutions we came up with today, about connections, about partnership. We've got to start demonstrating that. So by the time we come back next year, it's not just we're talking about the things that we need to talk about, but here are the solutions that we've built since the last conference, and a real demonstration of change. That's what I'm hoping from now till next week to next month to next year's conference.